I am Dr. B.S Bhatia from Chandigarh, and I am a diabetologist practicing for last about 40 years. And over the period, I've seen a lot of things happening, but here I'm, to sort of give some pertinent tips to my patients of diabetes and pre-diabetes. And pre-diabetes can ultimately culminate into diabetes. So it's very relevant for both the things. And the foremost thing is to sort of engage in a very active lifestyle. Walking, physical activity would be the prime thing, and it doesn't cost you much. You should be indulging in it. And then the dietary factors come into play. Excessive carbohydrate intake and excessive fat intake definitely leads to diabetes and would hasten advent of diabetes. And then comes the role of measuring your parameters like glucose and lipids and HbA1c periodically in India, because India is a capital for diabetes. People who have family members as diabetics, people who have weight above normal, people who have comorbidities like hypertension and some other abnormalities would need to monitor their blood glucose and their HbA1c. HbA1c is a 3-month average of the last sugar patterns for the last 3 months. So these would give you idea where what is going on. Keeping a healthy lifestyle, measuring your blood parameters, curtailing your diet, and then also sort of taking into kind that your profession, how it's sitting all the day, or it's not, it's sedentary. You have to alter that by changing the pattern. You could stand up over a number of times during the day, and you could make physical activity a bit of extra contribution in your day-to-day life. So I think these are the basic parameters or basic factors which will help you do well in diabetes. And once you're a diabetic, you're going to control it well with your medication, and maybe at certain point of life you will need insulin. Insulin is not to be feared about at all. Insulin is something which your body produces itself, and if you're short of it, you're supplementing. I think that the kind of gadgets we have for insulin again are very, very sort of non-traumatizing. The needles are so fine, the needles are so small, and the injectable pens and all would make your life much easier. So I won't prolong it long, but these few things will help you out to manage your diabetes better and not to get diabetic in the first instance. Thank you so much.